Hey everyone, Dr. Scott here with Good Shepherd Healthcare System with another video coming at you to help manage your low back pain. Today's discussion, the Flexion Intolerant Lumbar Spine. The Flexion Intolerant Lumbar Spine is one of the most common problems I see in the clinic. This problem usually manifests itself with pain located directly in the lumbar region. There are several different reasons why a person may experience this problem, and it's usually most present in a few different types of people. Students that sit for extended periods of time, desk and office workers, weightlifters with bad form, workers that repeat flexion-based movements, and the ever so common couch potato. In this scenario, the generator of pain is the disc. The disc is located in between each vertebra. It serves as a shock absorber for the spine and an anchoring point for each corresponding vertebrae in the spine. To understand why the disc is a generator of pain, it's necessary to understand a few simple components of its anatomy. The disc is mostly composed of two parts. It can be likened to that of a jelly donut. It has a tough outer portion, which is composed of concentric collagen fibers known as the annulus fibrosus, and then there's going to be an inner jelly-like core, which is known as the nucleus pulposus. The annular fibers seal in the nucleus and prevent it from migrating beyond its enclosed environment. When the disc is subjected to movement, the nucleus will migrate within its enclosed chamber. Repeated flexion of the lumbar spine will force the nucleus to continually migrate backwards and therefore exposing to repeated stresses of the annulus fibrosus. Nerve innervation of the annulus will detect this repeated stress and therefore present itself as low back pain. While this pain tends to present itself chronically and oftentimes difficult to fix, you should note it is very treatable. The first step in dealing with this problem is to identify the posture or the movement that's causing the pain and then eliminate it. Oftentimes, a flexion intolerant spine will respond really well with extension. This is the opposite of flexion. Most people will benefit from laying in a supine position or with the cobra pose. To perform this pose, lay in a supine position. You should be laying on your abdomen with your feet pointing out behind you. Place your hands next to your chest. Relax your back muscles and push upward to create an arch in your low back. Hold the pose for about 2 to 3 seconds, and then lower your back down to the starting position and recreate the same movement again. If this makes your pain worse, then this might not be the correct therapy for you. Of course, problems like these can be complex and require more detailed examination to dissect all the contributing factors. If you are dealing with pain that sounds like what I've described today, I invite you to come on into the clinic. We can go over in detail all the problems you're experiencing and properly address them and any other concerns you may have. We look forward to helping you in the future in your time of need.